So I have the honor of introducing Dr. Michael McKenna. Dr. McKenna is currently the Chief Surgical Officer and also co-founder of ACUOS, which we've heard about today from some of the otology research. He is a world-renowned neurotologist with expertise in translational inner ear drug delivery research. Prior to founding ACUOS, he held the Joseph B. Nadol Jr. Chair, was the director of the Division of Otology and Neurotology at Massachusetts Eye and Ear, and a professor of otolaryngology at Harvard Medical School. Dr. McKenna was our honored guest speaker at this year's resident and fellow graduation ceremony, and he gave a heartfelt talk about special people who were impactful in shaping his career as a surgeon, physician, and scientist. When I think of someone who is impactful in my career, at the top of the list is Dr. McKenna. So it is with great pleasure and honor that I introduce to you Dr. Michael McKenna. Thank you.
Steve, why don't you come down here as well? You know, it's a great honor and privilege for both Steve Rauch and I to present this Lifetime Achievement Award for Joe Nadol, who's had an incredible impact on both of our lives. Steve and I were there from the beginning of his tenure as chief to the very end of his tenure as chief. Recently, I attended Steve's retirement party at the Harvard Club after 45 years of service to the Mass Eye and Ear. And Steve took the opportunity to express some thoughts and feelings about Joe that touched me deeply, and I think touched everyone in the room. And I thought to myself, you know, there's just no way I can express this as eloquently as Steve has tonight. And I reached out to him within a couple of days and asked him if he would be willing to share that with all of you. And I really appreciate your having done so. So please, Steve, I would like you to tell these people what you expressed.
Thanks, Mike. No pressure. It is a pleasure to stand here and just add a little piece to what you're really going to hear about. Joe became acting chair at Mass Eye and Ear in 1984. The year I finished residency, and I was his first hire when he was acting chair. I didn't expect to get hired to work at Mass Eye and Ear. I knew I wanted to be an academic ear doc and felt I needed some research chops and talked with Joe about staying on as a research fellow. And he said, yeah, we could do that. And then a couple of months later, he called me into his office and said that Bill Wilson was leaving the department to go be chair at George Washington. Would I be okay taking that job? Twist my arm. So I did that. It took a while to get some research training, but I am forever grateful to Joe for that willingness to take me into the department and to mentor, to give me lots of red ink on all the things I was writing in early years, and to coach me along and to be tolerant of my finding my own path. And as the years have rolled by, there's something else that became more and more obvious to me as a legacy from Joe's administration, and it's the culture of the department. And you've heard from other people today about Monty's style and others style, the credo that Nelson had written out. Joe, when I was hired, I was number 7 in the department, and the department on the clinical side is 79 now. It's 10 times the size it was when I came in. And as Joe ran the department for all those years, he managed, created, cultivated a culture that celebrated creativity and curiosity, a culture that celebrated a really strong commitment to the pursuit of excellence, integrity, and respect for each other up and down the department, up and down the hospital. Culture of compassion, of generosity, of collegiality, and no ego. It was a prima donna-free zone. And as you heard from Charlie, as you heard from Jeff Harris, it's really unusual in any academic department to be free of prima donnas, to be free of ego. And at Harvard, unheard of. And so I just want to thank you, Joe, for creating that aspect, that legacy for all of us. I also want to take the opportunity to thank Brad Welling and to thank Mark Vivaris, who I think are as appreciative as I am of that aspect of the department, and to all our benefit have perpetuated it. So thanks, Joe, and congratulations.
Well, this is particularly meaningful to me because there is nobody who has had such a profound influence on my life, both personally and professionally, than Joe. He started off as my mentor, became my shepherd, and I am fortunate enough to say he is now one of my closest friends. And I truly love him, and I know that that feeling comes from everybody else in this room as well. So just a few career highlights. Joe was appointed the 5th chief and chairman of the department on June 5th, 1985. At the time, amazingly, he was only 41 years old. And at the time, there were only 5 full-time physicians within the department. He grew the department to 49 full-time physicians in the Boston campus and 21 physicians in the suburban centers as well. This is a chart that shows the receipt of NIH peer-reviewed funding in the department in 2012, the year before Joe stepped down as chief. And the Eye and Ear Infirmary at that time received more NIH funding than any other program in the country. During his tenure, the Eye and Ear Infirmary was ranked always within the top 5 programs in the country and often ranked number 1. In terms of his scholarly activities, Joe was cited more than 5,000 times during his tenure. His citation index, H-index, was 39, and 30 of his papers were cited 50 or more times. If you look at his number of citations over time, you can see that he became chief in 1985, and after becoming chief, the number of citations rose dramatically, which basically shows that despite all of his obligations to run a department of this size, a clinical practice, he remained productive in his scholarly contributions to the field, despite all of his other obligations at the time. So Joe was most interested in human otopathology, which he pursued through the course of his career. Joe was the first one to apply transmission electron microscopy to the study of pathologic human temporal bones, which is no easy task. As many of you probably know, this requires that the specimens are obtained and fixed as close to death as possible. So I have these visions of Joe hiding outside the door of a patient that's about to succumb with a little bottle in his hand and getting these fixed as quickly as possible. Otherwise, the information would be useless. And this led to a complete change in our understanding of Meniere's disease, where he demonstrated the loss of terminal dendrites, which you could not see on a light microscopic level. Later in his career, he was very interested in the histopathology of temporal bones in patients who were cochlear implant recipients, and has changed our understanding of what happens following cochlear implantation. Joe ran the human otopathology lab and group. Here you see him with Diane Jones, Barbara Burgess, Garfilia Pagonis, Jen O'Malley, Menu, Felipe, Alicia, and myself. And this group reviewed every set of pathologic temporal bones that came through the otopathology lab, and these were all presented in otopathology conferences, which many of us attended. Joe also assembled an incredible group of clinical otologists and neuro-otologists. One of the advice that I gave to all of my residents and fellows is if you have the opportunity, you really want to go somewhere where there are people who are better at what you want to do than you are. And you can learn from them. You don't have to make mistakes. You can learn from the mistakes of your colleagues. And that was a very powerful tool for all of us who had the benefit of being part of this group. Joe was the go-to guy for difficult cases. On more than one occasion, I called him on Saturday when I was doing a case in the OR, and I knew he was in his office working on his research, and asked him if he would please come up to the operating room and look in on a case that I was doing. And he not only would come in and give an opinion, he'd sit there for hours with me as I toiled through this. And I had the distinct impression that he enjoyed that as much as I did, even though it was taking away from what he had set out to do on that day. It was Joe's initiative to establish and build the Joe Nadol Surgical Skills Laboratory, which is the state-of-the-art surgical training laboratory used for all aspects of the specialty, not just otology, but for head and neck, for sinus work, laryngology as well. When it was first built a few years ago, it was better equipped than our ORs were upstairs. And on the top left, you can see what the lab was like before this, which was only 7 stations with really poor ventilation. And so we have all been the benefit of this. And not only did he see it through to completion, but he was one of the main individuals involved in the teaching of our otology and neuro-otology residents and fellows in the lab. Joe trained numerous fellows and residents in research. I think he's had over 100 research fellows in the course of his career, and he's trained many of our residents as well. And they've all gone on to do great things within the specialty, reflecting back on the Mass Ioneer. This is Joe at his Festschrift a few years back, surrounded by the residents, who all feel near and dear to him, as you can see, much like I do and Steve. Joe surrounded himself with really capable people. And not only were they capable, but they were also incredibly loyal to him. And so here he is with Stacy Gray, who was the director of our residency program, and before Stacy, Mike Cunningham. Together, they really ran the training program all the way from resident selection to the day in, day out training of our residents, and for which they are eternally grateful. Here he is with Gene McQuitty. Gene was Joe's right-hand person when it came to running the department, both on the research side and on the clinical side, managing the finances of really what was a pretty substantial business. Again, somebody who not only was outstanding at what she did, but she was incredibly loyal to Joe throughout his tenure as chief. And you can't give this talk without mentioning Barbara Beckman-Beard and Andrea Zweibels. They were the residency coordinators during Joe's tenure, also his secretaries for his administrative office. You know, his office was affectionately known by the residents as the Grizzly Cave. And I would walk in to see him on some days, and Barb would look at me and say, "It's not a good day." And I knew exactly what that meant, and I would turn around and walk away. He was equally surrounded by incredibly great people on the clinical side. Here is Mary Ellen Doyle, who was our practice manager, Kathy Lennon and Donna Hyde, who were our otology nurses, and Judy Kelly, who was Hal Shuknick's administrative assistant, became Joe Nadol's administrative assistant, and then finally became my administrative assistant, and still is my administrative assistant at ACUOS today. Here's Joe at Monty's Festschrift with Monty and his sister Jane. Here he is with Charlie Cummings, Eddie Applebaum, and Bob Sofferman, all close friends of Joe, all leaders in the field, all went on to become chairman of departments. One of the things that Joe was particularly excellent at, and here he is with Barry Benjamin and Tom Klein, is he was able to integrate the geographic part-time staff with the full-time staff. There was no town gown hostilities in the area. The part-time staff played a significant role in the training of our residents, especially in the operating room. They played a role in the governance of the institution, both on the medical staff and as the board of surgeons. And we all benefited from this integration, and they are all our very close colleagues. And that's often not the case, as many chairmen here can tell you. It's not an easy thing to do. Joe had a very significant international presence. I think you saw this picture earlier. Here he is with Jeff Harris and Jan Veldman from the Netherlands. Joe traveled not just around the States, but throughout the world, giving talks and teaching. Here he is at one of his skating parties with Hal Shuknick. There's no question Hal had a very significant impact on Joe's career and the direction that he took, both the real true leaders in the field of human otopathology. And I'm sure Hal played a very significant role in Joe becoming chairman at the very young age that he did. So they say behind every great man is a great woman, and there is no exception here. All of us who knew Joe had the great benefit of getting to know Ruth, or Ruthie as we called her. Joe brought her with on all the meetings, or most of the meetings that he went to, so they traveled together. They were constantly together, and Ruth really was his, and still is, his biggest supporter. They were the first ones out on the dance floor, and Joe and Ruth loved to dance every opportunity they had. And there's no question that Joe loved to have a good time when it was time to have a good time. Here Joe is with Marilyn Monroe, or maybe somebody who looks like her, and on the left is David Lim. It's pretty clear Joe's having a good time, but I'm not so sure about David here. But Joe is a consummate family man, loved his family. Here he is with his two sons, Benjamin and Joe. And you couldn't go to a Nadol gathering without getting to know Uncle Al. He came to every one of the gatherings. He was a man of few words, but you could see that there was a really incredible connection between Joe and Uncle Al. And I'm sure Joe and the rest of us who knew Uncle Al miss him. These are some of the grandkids, some of whom are here today. So we have Charlotte, Joe the third, or fourth, I think, Sam and Jake. And here is Superman, who the rest of us know as Clark Kent, and Benny the Pooh, and Princess Charlotte. And here is a chair that is filled with Joe, Jen, and Joe's boys. And again, a picture of the family, Ben, Krista, Joe, Jen, and her boys. So Joe, I want to thank you for all that you have done for our specialty and for the patients who we wish to help. I want to thank you for the Mass Eye Ear and all the people in this room today and those who weren't able to attend. And on a personal note, I want to thank you for all that you have done for me in my life on both a personal and professional level. And so congratulations on this incredibly well-deserved award. You are so deserving. Thank you.